Welcome to the presentation Connected College Health Network, which is being presented on June 8th, 2021. You will find the post-test for CE credit and an evaluation survey by returning to this session in the meeting event portal. We welcome you to submit any questions at any time during the presentation using the Q&A panel in your Zoom controls. We will save questions for the presenters and answer as many as possible at the end of the presentation. Dr. Van Orman is the Chief Health Officer for USC Student Health, Associate Vice Provost for Student Health, and Clinical Professor of Family Medicine, Division Head College Health. Mary Hoban is the Chief Research Officer at ACHA. Mary holds a PhD in Public and Community Health from University of Maryland College Park and is a Master Certified Health Education Specialist. Mary and her team have responsibility for managing data collection for the National College Health Assessment, National Faculty Staff Health Assessment, Patient Satisfaction Assessment Service, the Institutional Profile Survey, and numerous other survey efforts at ACHA. Arushi Uppal has collaborated with ACHA on the front-end development of CCHN. She is the subject matter expert in the use of CCHN and will be able to effectively demonstrate various data visualization reports showing interactivity and trends in the ACHA membership community's data. The presenters have no conflicts of interest to disclose, and with that, I'll turn it over to the presenters.
Good afternoon, everybody. I'll have we go ahead and advance to the next slide. Thank everybody for joining us today. For many of you who may be joining us know that we at ACHA have been working on the Connected College Health Network now for several years. We are very excited about today's presentation. This is really the culmination of almost 5 years of work on behalf of the CCHN committee, ACHA, and numerous members as we've worked to improve how we can gather data and information to share with our members and advance the field of college health. Today, we want to go through some of the ways in which CCHN can be utilized by members. To actually show you the first pass at the CCHN tool. We're very excited to give you a live demonstration. And then most importantly, to talk a little bit about how members can start to participate and access some of the features of the CCHN. Next slide. So CCHN really started from many of the college health data challenges that I know many of us who work in college health and are in leaders of college health face as we look at how do we design systems of care that improve the health of our students. We have healthcare data for students in various systems. We have information within our electronic health records, including information about diagnoses, clinical outcomes, and utilization. We have information in our student information systems, including demographics of our students and information about their academic progress. We also know that there's lots of data about the environment of the university, what kind of services and programs we offer, what some of our health promoting policies are, and what are some of the other factors that might influence health. We do lots of population health surveys about health behaviors and substance use, things like our own National College Health Assessment, but other tools that are used nationally, such as the Healthy Minds Study and custom surveys developed by our universities. We know that there are good national data from the federal government through the IPED system on universities, including detailed demographic information about students, about their graduation rates. And then finally, we have insurance claims data. All of this information can paint a rich picture of health on our campuses and help to design and improve population health. However, on most of our campuses, these information systems are disconnected or only minimally connected. And at the national level, there's no clearinghouse in which we can make connections between these various types of information. This was the challenge we set for ourselves several years ago when we started to conceive of the CCHN, was creating connections between all of these sets of information. And we'll update you today about where we've been successful. Next slide. So the vision is really to think about how we can create this national college health data warehouse. The goal, like many of our institutions, is not just population health, but population health in the service of educational achievement and health equity among our students. We want to be able to integrate ACHA systems to allow our members to drive data-driven decision-making, to provide access to the kind of information that our leaders need, and to develop a platform of informed healthcare. Some of the immediate uses that I know many of us think about are surveillance for outbreaks and chronic disease monitoring, and how to inform health policy. This is certainly for many of us, as we've gone through the past 18 months of the COVID-19 pandemic, understanding the need for surveillance, understanding needs for systems of data management has become very clear. I know that for any of us on any of our discussion forums, a month or week doesn't go by when we're asking for benchmarking information. How are we doing compared to our peers? And whether that's a request coming from leadership or information we need in order to ask for new resources, benchmarking is an ongoing need for us in providing college health services. And finally, we know that we need information to do QI. What is the standard of excellence? How do we improve the care delivery? And how do we make sure that what we're providing is the highest quality of care? So that's what the CCHN hopes to do. Before we go on to the demonstration of the actual tool, I'm going to go to the next slide. I want to take a moment to talk about how CCHN will be going about protecting your data. One of the early questions we've got from individuals as they've been asked to provide information to CCHN is trying to understand and explain to their campus administration, making sure that the information that might be housed in CCHN is protected and that security measures are in place. So I wanted to walk through a little bit of what we've done with that. And in fact, this has been a major focus of the project over the last 1.5 to 2 years, is making sure that data protection was a key part of what we were doing. So first of all, the CCHN will only ever host de-identified and aggregate data. The current data is housed within a virtual private cloud and subnet within Amazon Workspaces. There are security groups established, including firewalls for controlling inbound and outbound traffic. We'll talk about later in the presentation about user access and how individual schools can participate. And with that, understanding how we're going to be able to allow users to access their own information, but not others, so that having unique credentials will control the amount of information that others, and making sure that someone from one school will not be able to access somebody else's information. And finally, most importantly, over the last 1.5 years, ACHA with our support vendors, can you go back for a moment? Our vendors have put into ongoing monitoring services. So currently we have 24/7, 365 days a year monitoring of access to the tool so that we can detect anything that would potentially pose a security risk. So that's just a little bit at a high level with the project. We'll have time to get into any of those use cases as we move into the Q&A period. But now I'd like to turn it over to Arushi, who's from one of our partner vendors. And she's actually going to be able to take us, very exciting. This is our inaugural demonstration of the CCHN tool. So very exciting. Arushi, if you want to walk us through some of the reports of our data warehouse.
Yes, definitely. I'm going to go ahead and share my screen. All right, so I'm basically going to take you through some of the features of CCHN. We'll look at logon specific functionality and a summary of a few of the reports that we've created. We'll see both sort of basic reports as well as enhanced reports, which offer access to institutional specific data for your institution. And we'll also explore some of the interactivity of the reports as well. So without further ado, I'm going to log in as an individual without access to institution-specific data. And this is a test user account that you'll see here. So this is the login screen for CCHN. I'll put in the credentials and then just hop on in. Amazing. So here you'll see 10 different interactive reports sort of tiled here. This is sort of a beginning of an effort to create a sort of cohesive health and wellness profile within the central data warehouse. We have reports ranging from mean staffing to immunization requirements, immunization requirement policies, and each report is designed to be interactive, personalized, and to help support those CCHN goals that Sarah had mentioned, including benchmarking. So the first report that I want to take you through is the institution tobacco use policy report. So that one's this one right here. This is a basic report, so there will be no institution-specific data. And this is sort of the standard layout of each of the reports. So you'll see a sort of graphic visualization at the top and a corresponding table at the bottom, which has the data in it, as well as the total number of institutions. We have a filter panel on the left-hand side, which has different institutional characteristics for which you can filter the data by. So you can select a specific cohort that you want to look into, institution type, region, and size, and both the graphic part and the table will both update based on your selection. There's also an about this report at the bottom that gives some more specific information about the report. So this specific report shows the frequency distribution percentage of question 59 of the IPS 2017-2018 data set, and it's sort of visualized as a pie chart. For this question, the respondents were asked to choose one best answer to fit their campus tobacco use policy. So here we have the frequency distribution, and you can see 43% of the 171 institutions had all tobacco and ends prohibited as their tobacco policy. And we'll sort of see that number change as we interact with the report and filter it down and drill down into the data. I always find it's really helpful to drill down the data with a question that we're perhaps sort of looking for. So a question can be specifically for benchmarking: what does the frequency distribution look like for institutions similar to mine? And we'll use my alma mater, which was a large public school in the South. So I'll go ahead and sort of select that cohort here, and we'll see the data sort of update in real time. So I'll do public. Here I'll do South, and I'll do large, so greater than 20,000 students. So as you can see here, the N has sort of whittled down to 23 institutions, and we have 61% of those have all tobacco and ends prohibited. This is really helpful, again, for benchmarking. I don't really remember my institution's tobacco use policy, but if I was tobacco permitted in designated areas only, and I was trying to push for maybe a change or just to even see what other similar institutions look like, this data would really sort of help inform what that looks like and give me at least some basis and some numbers to play around with. We can even look at maybe like an opposite sort of school, so maybe a private school in the Northeast. So I'll select private only and then Northeast only, and then we'll do all institutions. And we can see here that what was previously 61% for the cohort that I had selected with large public schools in the South has whittled down to 17%. And we have a more even distribution, it seems like here, with an N of 30. So this is really interesting. Even if you don't have a specific question, you just want to explore the data and just see what happens when you toggle things on and off. The sort of interactivity supports that as well. Another cool sort of functionality that we have with CCHN is bookmarking. So maybe I always want to see private schools in the Northeast, and maybe every time I look at this report, I don't want to have to select it. I can go ahead and just bookmark this view here. So I'll add a new bookmark that maybe says private institutions in the Northeast, save it. And then anytime I log in and see this report, I can always just click on this and the view will update. So that's really helpful. I can also, so if I go back to my public schools in the South, we see the data that we saw before. And then if I want to go ahead and change it back to private institutions in the Northeast, I can just click that, continue, and that'll update here. So that's another interesting way to sort of quickly get access to the information that you need. Another cool sort of functionality that we have is sort of how we can share this information. So there's a few ways to do that. If I toggle this button here, we can share this dossier with anyone who has access to CCHN. So they'll receive a link, they'll have to log in with their credentials, and so that security will take place and they'll be able to view their version of the same report. This is a basic report, so if you have access to CCHN, this report will look the same for everybody, but that's specifically important for perhaps our more advanced or the enhanced reports, which will look different for each user. Another way you can sort of take the data out and share it is exporting the grid to Excel. So maybe you want to use this data in a report, but maybe the color scheme isn't the best, or maybe you don't want a pie chart. You can just export the grid to Excel, you'll have the data, and then you'll be able to visualize it in whatever way makes the most sense for your situation. And then you can always export the entire view that you have. So that includes everything that you see here to a PDF and then share it that way as well. So yeah, that's sort of a gist of a few of the reports. I'm gonna hop out and show you a few of the other reports. We'll look at I'll reset this. We'll look at a enhanced report now. So one of the enhanced report is the mean staffing full-time employees per 1,000 enrolled students. This tabulates the mean number of full-time employee staff broken down by employee type and shown per 1,000 enrolled students. This is, I think, derived from IPS question number 29. Again, we have the similar graphic visualizations at the top, corresponding table, filter panel, and information at the bottom of the report. You'll again be able to interact with the data. So we can maybe even spot the difference between public schools here with mental health staff at 0.5 per 1,000 enrolled students. And then I think the difference is really interesting as well for private, because that number shoots right up as well. So again, you're able to sort of select and deselect a different cohort and see how this aggregate data changes. Another interesting sort of interactive functionality is you can sort of pick and choose what you want to see. So for example, if I'm not interested in administration and support staff, and I just want to focus on these other four employee types, I can right click and exclude the data. And then it'll just show me the information for the other four. If I ever want to go back, I can always reset the report here and the full report will always come back up. So it's really easy to access the data. We've tried to design it that way, you know, clicking some buttons and getting to where you need to go and getting the sort of information that you need to make whatever insight that you need, maybe in a meeting or a presentation or whatever the use case might be. As I said, this is an enhanced report, but I logged in as an individual user with no institutional access. So I don't have access to my institution's data. But if I log out and log back in with a user that has access to their institution's data, this report will change. And I definitely want to show you what that looks like. So I'm going to log out and log back in and show you this report as an individual who has institutional access, institution data access. So go back home, log out, and let me get my credentials here. So again, I've logged in as a different test user. I'll see the same 10 reports, but if I hop into the mean staffing full-time per 1,000 enrolled students, you'll see now we have an orange bar as well. So this orange bar is my institution's data, and the dark blue is the sort of aggregate that we saw before. I think this is one of probably my favorite functionality of CCHN is really being able to see how my institution compares to an aggregate. And I think this is where the interactivity and the benchmarking can get really fun. So here again, we have the same filter panel. These filters will only apply to the aggregate data. So your institution will never disappear. That'll just stay stagnant. So again, if we want to look at public schools in the South, and the 20,000, the large ones, we can see how the data changes. And, you know, we can see that we're consistently doing pretty well above the aggregate data. And this is really helpful, again, if we're looking at kind of what Sarah mentioned, which was resources. If we were under, maybe arguing for a little bit more or whatever we need, this is sort of some data that sort of helps us get some insights from for whatever purpose we need. So yeah, so this report is really interesting. There's a few other ones that I want to take us through as well, both enhanced and basic reports. So I'll go ahead and reset this. And then we will take a look at laboratory services. So this is a basic report. So it doesn't have any institutional data. This summarizes the proportion of institutions providing different types of laboratory services in college health centers. So here again, we have a graphic visualization, table, filter panel, text. As you can see, the filter panel has less filters. We only have region and institution size, and that's because the public-private institution type is actually here as a clustered bar chart. This is another interesting sort of visualization because we can see how a selection of filters will affect all institutions, public institutions and private institutions at the same time. Again, we can select maybe Northeast, and we can maybe do everything but large, and we can sort of see how the data changes as well. And I'll move on to another report. So we'll look at the health center size. This one is another enhanced report. So this report will display two different charts showing the square footage of space compared by standard campus demographic controls. So one of the charts will show a total mean square feet, and that's this chart on the left, and the other will show a calculated value of mean square feet per 1,000 enrolled students. Again, this is a enhanced report, so I can see my institution's data as well compared to all institutions, public institutions, and private institutions. If I had logged in as the user, the first user that I logged in as, this orange bar would have disappeared and I would just see all public and private. Like the other report, I can use these sort of filters to filter the aggregate data. So I'll look at maybe everything but large institutions and we'll see sort of how this number changes. And we can even toggle the region as well. Another report is the services provided report. This one tabulates the services most and least frequent in college health centers in two visualizations. So we see the most common services provided here, as well as the least common services provided here. And again, with the corresponding tables. Again, we have this filter panel where we can sort of select different characteristics and see how that affects the data. So if we look at public institutions, we'll see how this number sort of changes. 24-hour infirmary care is one of the least common services provided at 3%, while immunizations is at an 88%. Again, these are, I just want to give you a taste of a few different reports that we have to sort of show you the types of data that we are reporting on in CCHN as of now. All right, and with that, I'll turn it over back to Mary, who will kind of go through a few other aspects.
Okay, I'm sorry, I have to talk out loud to get there. Share this screen again. I'll ask my co-presenters to make sure that we can see I'm showing the right screen, huh? A little nod in the chat box would be helpful. So, okay, thanks, Christine. I am going to pick up here from that demonstration and talk a little bit about where we are in CCHN access and usage. And Sarah mentioned we've been at this for a long, long time. And we've made, I think, I hope you can see tremendous progress in what we've built in the demonstration that Arushi shared. We are also have light years away from our intended goal. So we do still have quite a bit of work to share and to get done. I'd like to just give you an idea about where we are sort of right now. So I'm going to start with kind of who can have a CCHN account. And the system is set up. We've been talking to our members over the last few years that there's really only two things you need to do to have access, and that is to complete the annual institutional profile survey and to maintain your institutional membership in ACHA. To date, we have about 250 institutional members. I'm sorry, I see a typo in ACHA on that slide. To date, we have about 250 institutional members who have completed one or both of the first two IPS surveys. That would have been for the 2017 and 18, and then 2018 and 19 academic years. So they were eligible for participation at this point. To date, we've activated what we're referring to just as a soft launch to just 14 of those 250 institutions. These 14 schools have been exploring the system that Arushi just walked us through and providing us with feedback about their use. We're in the process now of kind of prioritizing that feedback that we've received to determine what we can and must implement right away and what can wait until we have more funds available for system enhancements. So the remaining 236 schools, I'm sorry, I didn't mean to do that. The remaining 236 schools will soon, out of the 250, minus the 14 in the soft launch, will soon have the opportunity to request from us an account to get into the system that we just demonstrated. ACHA members will access the warehouse through MicroStrategies. That is the data visualization tool that we've chosen to front end CCHN. That's where Arushi was signing into the account to get access to the reports. But keep in mind, each one of those accounts with MicroStrategies requires that ACHA pays a licensing fee for each school. So because we don't want to assign accounts to folks that aren't going to use them, we'll have a request process for that. And you guys will see something about that in the second half of this year. In August, these 250 institutional members that are already participating will be asked to update their IPS entries for both the 2019 and 2019 to 2020 academic year, as well as the current academic year, 2020 to 2021. We're collecting 2 years worth of data at one time. It's our intention to get on a regular cycle so that when that academic year closes at the end of June every year, or around the 1st of August, we'll be able to open up the IPS survey for the next time period, and then allow people to work on updating that IPS survey. We'll leave that open for a couple of months, probably through the end of October, because the license period is an annual license we pay to MicroStrategies. That's going to follow the ACHA member calendar year, which is a calendar year. So as long as your IPS is done before it closes in late October and your institutional dues are paid by the end of December, you should have uninterrupted access into the next calendar year for CCHN access. let me just double check my notes here and see if there's anything else I wanted to add to that. Like I said, these MicroStrategy accounts are for a 12-month period from the date of activation. So once that activation is made for a campus, the RMIs, the representative of the member institution, or their designee, they could designate somebody else kind of be responsible for CCHN access for the institution. They can request to add up to 2 more users per institution at this time. As the program grows, we anticipate that you'll be able to add as many users from your campus as you like, and that administrative designee on campus will determine who sees just the generic reports and who has access to your local data. Every enhancement we do to the system costs money at this point. And probably unlike most of your schools, ACHA has been dealing with some budget constraints in the last year and a half that we didn't anticipate. And so we're trying to make strategic decisions about how we get folks access and then how we can increase that access and increase the costs at the same time. So let me go to the next slide here. So this, I want to talk to you a little bit about what users can actually do with an account. And the information, as Arushi pointed out, that you view in CCHN is going to depend on the user type. The first 2 user types that you see on your screen here are actually going to access information outside of the CCHN system. They're not going to log into anything at all. And those 2 types include the general public, who will have access to just a select few basic reports posted on the CCHN website or the ACHA website. The reports are going to be static, so they're not going to be able to interact with the information or choose different filters as Arushi was able to do in the demonstration that she gave you. That happens in MicroStrategies. So we're going to have some information available, limited information for the general public, for the media, for parents, folks who might not have a membership in ACHA, but also have some interest in this information. The next category of user would be our individual members at a non-participating institution. And that non-participating institution is either not a member institution, or they're a member institution who chooses not to participate and complete the IPS. So these reports will also be static so that the user won't necessarily interact with them. I don't know why that keeps advancing. I'm sorry, let me get back to my place here. These are going to be these folks are members in ACHA, so they're going to certainly have access to more than what we have available for the general public. They will be behind the member wall on the ACHA website. So again, it's a different level of access at that point. Now, the next 2 user types are those folks that are going to interact with data visualizations using the CCHN tool functionalities that Arushi just showed us. So that's going to require CCHN login name and password. The enhanced member without institutional comparison those are the folks that have access to just the aggregate data that Arushi first showed us that didn't have the my institution associated with those graphics. And then the next one is the enhanced member with institutional comparison. So they're going to have access to both the aggregate data plus their institution's comparable data where applicable. You may have noticed on the tobacco policy, there wasn't an institutional comparison because we presume you know your tobacco policy on campus, where you might not know the number of FTE mental health providers per 1,000 enrolled students. So some of that's just going to logically follow that case. So in terms of content, the bulk of these CCHN visualizations and all the filter functionality are going to occur on the right side of the screen here. So moving left on the screen, from the left on the screen, a smaller static subset of those visualizations will be available to those other ACHA members and non-members. Now, you may have noticed when Arushi was in the system, we currently only have 10 visualizations or reports available in CCHN. So there's not a lot of ways I can divide those 10 visualizations up into these various groups. So it'll be some time before I think we could really call CCHN a true data warehouse. And it'll have the full functionality that we've been dreaming about and talking about. This is really just a baby step. But as that system that you log into fills up with lots and lots of reports, I imagine hundreds of reports that will be organized in such a way that makes sense for the user to find them, then a select number of those will be available to the two groups on the left side of your screen that are not CCHN users. Okay, let me go to the next piece here. It's that visualization tool that in MicroStrategies that really makes the system, it makes it possible for users to interact with the data and customize that visualization to draw out insights that then they can share in a number of different ways with some of their stakeholders. We're really taking a staggered approach in developing CCHN. We've started very small, and I should say, while 10 may not seem like a large number of reports, the infrastructure that had to be put in place in both the technology to make it happen as well as the security to keep it safe and keep it running was an enormous project. And some of it really the same, whether we have 10 reports or 100 reports there for you to look at. So we're excited to have this little bit to show with you, but I hope you can appreciate a little bit of what it took to get here. So during this early launch, users will have the opportunity to apply several filters, like by institutional type and geographic region, the size of the institution. We hope to add lots more filters that people may be interested in seeing as well. The IPEDS data is coming from the Department of Education. Sarah mentioned that on the front end and how much data we get from that about the institution and about students at that institution. The data sets within CCHN are going to be linked by that IPEDS unit ID number, a unique identifying number that every school has. So that's really kind of our first, where we are right now is working with that one IPS data set and then some of the IPEDS data. As we move forward in the next couple of years, we're going to be looking at adding data from the second IPS survey while we're collecting data for more IPS surveys and getting the NCHA data loaded in. We're actually starting with the NCHA2 data because those are the survey, the data collection periods that correspond to the periods that we have IPEDS and IPS data for. And then in time, we hope to move into adding other data sources. Certainly the NCHA3 will come after that. We've talked with Healthy Minds about sharing their data and making connections between their data and some of the data sources we already have, as well as looking at clinical data, whether it's coming out of the medical record as a CPT ICD code, or whether we're looking at insurance and claim data. So there's lots of opportunities to build here. We're really, again, kind of at the basic baby step level in getting this off the ground here in the current state. What we'd like to do next is share with you, we're going to switch back to Arushi to share a visualization that will demonstrate how we hope more than one data set will interact, and what we kind of a look into the future. So you take that away, Arushi.
Hi, okay, great. So yes, I want to kind of talk a little bit about, show you a little bit about what Mary was talking about where we're headed. So far, what we have, I think, is a really great foundation, like Mary mentioned, of those 10 reports reporting on IPS 2017-2018 data. And as we add more data sets, the reporting that we will get more reports, but also the reports that we have will have another dimension to the sort of data. A lot of the reports we have now are policy related, and tying that into the student reported data in NCHA2 will sort of give us another side of the story. So I kind of want to show you one of the reports that sort of builds on the tobacco use policy report that we saw earlier. So we'll go ahead and log in again. So this is the student tobacco use report. Here we're joining that question 59 of the IPS 27-2018 data set to the NCHA2 data set to explore like the relationship between self-reported cigarette and e-cigarette use among students. Just a little bit of overview on the format. We have the top half, which looks at cigarette use by institutional characteristic. We have a stacked bar on the left that shows usage by institutional characteristic, namely tobacco policy. So here you'll see that, or if you remember from the first report, we had tobacco policy. This visualizes the frequency distribution in the pie chart. Now you see it here per tobacco policy and institutions with this tobacco policy. What does the actual usage look like? So this sort of gives another side to the story. So maybe we start off looking at just the frequency distribution of the tobacco policy, and we sort of benchmark our institution and see what we're looking at. And then maybe we can come to something like this and sort of see what the usage looks like in this situation. The bottom half is student e-cigarette use. Again, we have that stacked chart on the left and then the corresponding table on the right. This report also has filters. There's no filter panel here because as we sort of move forward, we'll start to have more and more filters. So we'll utilize some more functionality of CCHN. So here on the top right, we have a filter sort of menu that comes up. So you're able to filter by tobacco policy. So if I only want to see everything but tobacco prohibited and ends permitted, I can go ahead and change that. I think it's this one. And then again, we have the different institutional characteristics. So we can go ahead and apply, and then we'll see how the data updates. If we go back to, if we look at some of the data here, we can see that the lowest percentage of never used of students reported never used, that they never used cigarettes is for institutions that have a tobacco permitted policy, which for me makes some sort of logical sense. But as we get more and more data and more institutions that fill out the data, this will become representative or more representative of what's actually going on. And hopefully we can add more and more dimensions, not just to tobacco policy, but to a lot of the other reports, as well as building on more reports in the future. So that was just a little sort of prototype vision as to where we're headed in the future. And I'll go and turn it back over and stop sharing my screen. All right.
All right, so we do have some questions in the Q&A. I know some of these have been answered in there, but not everyone's probably reading that as we go along. So I'm just going to go ahead and repeat those questions for our presenters to answer. The first question is, will it always show data for the most recent report?
Successive years of IPS are loaded, and Mary can jump in here, or Tren. As each year is loaded, then we'll actually start to develop longitudinal data as well. So that's really the critical piece of this is IPS 1819 is the next data set to get loaded. And then as Mary mentioned, we're going to be sending out a request for the 1920-2021 IPS. And that's where we start to really get powerful information, where we can actually trend the IPS data over time. There was another question in the chat that really talked about how challenging it was. The IPS is a lot of data, and I totally appreciate that. I particularly appreciate it because I fill it out for my institution. So I feel it both like theoretically and actually. But the other piece I'll note about completing the IPS is that once it's done once, Mary has done an amazing job of just allowing people to update their data. So that's really the goal, is the trending data that adds another complexity to it. Mary, any further comments on that, or does that capture it?
Well, I think you make a good point, Sarah, that we can't deny how hard that's probably one of the most difficult surveys we've ever asked our members to complete. And yeah, it's not coming typically from one person at the institution. Takes a lot of work. But the hope is that the first one is always going to be the worst one. And from there, you're updating your usage figures, your staffing figures, your visits, that kind of stuff. And if perhaps a policy changes, which might not be that often, but it'll hopefully get easier as time goes on. And yes, you're right. All you can see right now in the system is 2017, 2018, because that's all there is in the system. Eventually, there will be multiple data periods added for that same, for those same survey tools. So one filter might be that you pick the year that you're interested in, or you look at all years over time. The possibilities are really endless when you consider how many questions are on both the IPS and the NCHA. We could have thousands of visualizations just from those two alone. But I would say in this test, we probably weren't as careful at telling people what they were looking at. And that's one of the pieces of feedback that came back. Oh, this is 2017, 2018. That was obvious to us because there was only one set of data in there. We knew that. But note that you'll be able to choose, hopefully, various periods of time that make sense to answer the question, that particular question you're trying to answer.
The next question is, how would I know if an IPS has been filled out by my institution in the past?
Shoot me email. Be happy to answer that for you.
Do you want to share your email in the chat, Mary?
Hey, that's a good idea. I get so much email, I assume everybody has it. Let me see here.
Okay, and the next question is there any contemplation about including positional salary data in the CCHN? Unless I have missed it, I think the most recent ACHA salary survey was in 2016.
Oh, I love that question.
Yeah.
You go ahead, Sarah.
Yeah, we definitely have discussed it. And I think that it is definitely, I think, an element that would be in subsequent versions. I think right now, to the earlier point about getting people to complete it, that we had to make some decisions about just the core data. But I think it's something we're going to keep watching, and Mary agrees, and adding it as a future, probably not for 1920 or 2021, but potentially after that. It is a challenging, it's just about the, the amount of information we're asking people for. Mary, what are your thoughts on that?
There's probably not a question we get more often in the national office, which will surprise none of you because you all want to know the answer. Yeah, and there's a sort of a newly resurrected benchmarking committee that's looking at this question as well. And one thing that we are still kind of trying to figure out is how the IPS interacts with other periodic survey efforts at ACHA, whether that's a salary survey or the sexual health services survey, a student health insurance survey that goes far more in depth than what we ask in the IPS. And we're kind of figuring out that dance and how it's going to work. I hear you that we need to get some salary information collected sooner rather than later. And we're talking about it. It may be a standalone survey one time. I'm not sure exactly how that's going to work out.
And one of the ways I might think about it is the IPS is things that are updated annually. And it may be that there are modules, for example, that get put on, that like the salary that maybe isn't something that's done annually, but are, and there's other requests as well, so I think that's an interesting question.
And we have one other question. If anyone else has questions, I think we might just got some more in, but feel free to keep adding them to the Q&A box at the bottom. So our next question is, where can we find definitions for the various data categories? For example, which types of staff were included in other medical staff?
So there is the actual IPS survey, and I believe it's on the website, Mary, but there is actually a very detailed definition and glossary for when people are completing the survey. We'll make sure that's publicly available, but there's actually a very detailed set of definitions for each of these categories.
That's a great question. Sarah's right, it's in the survey. It's in the full report from the survey, but that would be something helpful to have on that slide in the description as we talk about what other medical providers are. Thanks. But part of once we get these first 250 schools in and our folks have some time to play and really kind of ask questions, it's your feedback that's going to help us drive the next steps. Where do we invest the next set of money in developing new visualizations or enhancing the visualizations that we have? And that's exactly the kind of suggestion that's helpful, is what it probably should be right in that visualization so that you don't have to go to other sources to find out what that means. Some of that stuff sounds kind of obvious, but and it won't surprise you, it probably happens to you guys too, that we're so far into the weeds here. Sometimes that obvious stuff just didn't cross my mind, but I appreciate that kind of feedback. That's very helpful.
Okay, we'll do one last call for questions if anyone has any, or if the presenters have anything else you'd like to add before we close the session.
I just want to take a moment to express my gratitude to our partners at Tyrula, Trin Choi, who's on the call, who's been our program manager, Mary Hoban, and the entire ACHA staff who have kept this project going through challenging times, and then as well as the CCHN leadership committee, and many members who have devoted hours to this project to make it run. I mean, this is one of the most kind of common sets of questions we get, but there are many, many, many members who have participated in this, and I'm very grateful to them, as well as our team at ACHA.
Good point. This is probably one of the biggest labor intensive and perhaps costly programs we've ever undertaken. And we certainly couldn't do it without the tremendous feedback that we're getting from the members. And it's not a light volunteer responsibility. Folks are giving us lots and lots of hours, and it is really appreciated. I hope you can see how excited we are, even with these baby steps and it's a start, and I hope that you guys can see the vision with us, because we're only going to get there if you help us contribute the data to it.
And what's the best way to contribute the data to it, Mary?
Is to complete that IPS survey when I send that request out. And we're actually, it's unfortunate a session got canceled. That's how we got moved into a live session. I'm so glad we did and had the opportunity to actually interact and hear some feedback. That's terrific. And we look forward to seeing you in San Diego and showing you all kinds of new things next year. Please keep your feedback and questions coming in. I'm always happy to take a look at that. And if I can't answer it, I'll get it to somebody who can.
All right, I just got 2 more questions in. One asked, I may have missed it, but could you please share the link to the data?
The link to the data. The data actually, you can't, the things that Arushi was showing you, you can't get to just yet. There are 14 schools that are part of the soft launch that have access. And in the next, after the 1st of July, we'll be getting access to the other 236 schools that have participated in the IPS. So that's coming. That's done through a MicroStrategy account. I would encourage you on the website, on the CCHN webpage, we do have a report that shows the data from that IPS one that we just shared with you. And we are working on the report from IPS 2, collecting the data from the next couple. So we'll always, to supplement, have that sort of PDF of a static report that folks can refer to. I hope that answered the question.
And then there's 2 questions about when the next are going out.
When the what's going?
The
next,
IPS. IPS.
Yeah, it's my favorite question. Well, look, we've been, it's been delayed, obviously. That should have been out last summer, really. And we've been having some conversations, and it's almost time now for a new one to be out in August. And we've been having some conversations about how hard they are to complete and how much work it is that we're asking for people. And I have been asked to slow my roll and not, it could go any slower, but to wait until August and ask for the last 2 years worth of data at the same time, so that you guys can work on this once, be looking up things at the same time, do it side by side. So you can expect in August, at least the 250 schools that have already given us data can expect to get a request to update for the last couple of years. Some of you have been asking me, and I said any day now, and that changed a couple of days ago. So that's kind of the new information. One thing we're trying to balance is, we've promised everybody that does the IPS, they're going to have access. Well, we also have to pay for the accounts to give them access. So we're just trying to figure out how much money we can spend on this and still get the information we need. And eventually we're asking certainly every institutional member again to do the survey. We're still trying to figure those pieces out. It's a delicate balance of the funds, of which there are very few.
All right, well, that is all the time we have for today. Thank you everyone for attending the session, and thank you to the presenters. To follow up with any unanswered questions or to continue the conversation with presenters and colleagues, you can return to the event portal and visit the session's discussion tab.
That's great. Thanks. Thanks everyone. And Sarah and Arushi, thank you.
Thanks, everybody. Goodbye.
Everybody. Are we done? Just go on.
You can just go. I know it's an awkward moment.